ওটা তো না মাইক্রোফোন না মাইক্রোফোন লাগবে না ওদের সাথে কথা বলতে শুনতে পা We have started our live. How many people are connected with us? Can you hear me? The sound is clear or any problem? You can comment here and so that we can see this. How many people have joined with us? I can see 6. Is it? You can mention your roll number in the comment box so that we can count your percentage, how many people are connected with us. Today I am going to talk with you about the air symptoms. You have seen it previously. Symptoms of air disease. How many people are connected with us? 8. The number is too small. 9. Just I wait 1 minute so that you can connect with me and today our topic of discussion is the symptoms of air. Do you see my screen, what I have shared with you? If it is okay, then comment it. And here is, I think here is the full screen of my screen, and here is another form of screen. Which one is better, previous one or this one? In this stream, you can see me and as well as my slide in the screen. And other side I cannot see myself, only I can see the slide. Which one is better? Which one you prefer? Please comment on your comment box which one should be followed by us. CR Rodoshi, where is Rodeshi? I'm not seeing Rodeshi any here. Sajin Hawk, which one is better? You can comment 1 or 2. 1 is the whole screen and 2 is the screen with me. Now what you have seen, it is the 2 and 1 is the 2. Now 2 is this. Okay, thank you. So we can start this, but here is a problem that I cannot change my slides with my cursor. So it is a problem, I cannot change it. Okay, fine. Okay, we will start. Only 9 people connected with me. Only 9. It is pathetic. So we can discuss the symptoms of air. Here is our lecture. go. Symptoms. So let's start symptoms. Common symptoms of the ear are the earache, deafness, discharge, tinnitus, vertigo. These are the common symptoms that we encounter, and we have discussed these symptoms in the word placement. Now in the lecture schedule, we are discussing something about the theoretical aspects of these symptoms. So all of you have to follow that we have more than these symptoms, just common symptoms we are mentioning here. The common symptoms: the earache, deafness. You have to memorize this thing: earache, deafness, discharge, itching of the ear, tinnitus, and vertigo. These are the common. Uh, Outside this, there are sometimes there is a facial palsy as a symptom of ear, and sometimes headache. Also, the symptom of ear diseases can be studied. And for the discussion, we want to touch all the things. First of thing, the earache. Earache. The first thing, the earache may have some causes. Some causes are local, some are referred, and some are psychogenic causes. Any disease may have some psychogenic parts. The local causes of othalgia. Earache means earache can be described as the othalgia, pain in the ear, or any other form. For the local problem, we can see that ear can be divided into the external ear, middle ear, and the inner ear. So when we think that there is a cause that present in the ear itself, so for the descriptive purpose, we can divide this cause into the external cause that remains in the external ear and some causes that remains in the middle ear. Inner ear is very far away. That is less nerves that sensory nerves that supply the inner ear. Inner ear is mostly supplied with the our special nerve, that is the vestibulocochlear nerve. So the disease that affect the external ear, like the furunculosis, otitis externa impacted wax. That means the wax are impacted into the external auditory canal. Usually, we have the wax, and that has the natural clearance system that can be cleared from the external air canal. Sometimes some foreign body, sometimes some trauma may cause the earache earache that pathology remains in the external canal. Herpes zoster is a viral infection that form some form of bulla over the external canal, and sometimes this bulla is formed over the tympanic membrane, that is known as the bullous laryngitis. And malignant otitis externa, and another cause is malignant growth of external ear. Here two terms: one term is the malignant otitis externa, another term is malignant growth of the external ear. This is two different things. First thing, malignant otitis externa. Sometimes we will ask you in the written question to write a short note on the malignant otitis externa. This malignant otitis externa is an inflammatory condition, not the true malignancy, but it behaves as like the malignant condition. Do you see here roll number 2, Ifadul? Ifadul, is Ifadul present here? If not, please inform Ifadul to attend this class. He was absent my previous class. Ifadul, roll number 2. So this is the infectious condition that behave like malignancy, not malignancy. And malignant growth, that means the malignancy, true malignancy in the external canal. Usually it is the squamous cell carcinoma in the external canal is the um, This may cause pain in the external canal. In the middle ear, the pain may be caused by the inflammation or infection in the middle ear, some form of acute, some are chronic, and eustachian tube obstruction, barotraumatic otitis media. That means when someone fly in the aircraft, or when they dive into the deep sea, that may produce a uh, barotrauma. That means trauma due to pressure in the middle ear. That is barotraumatic otitis media. Some form of acute mastoiditis that is commonly affect the children, acute mastoiditis, and extradural abscess and carcinoma of the middle ear. These are the rare conditions, the carcinoma of the middle ear, that may produce pain in the ear. Here, carefully see that in the middle ear cause, there is no chronic otitis media. When there is the simple, where there is the simple chronic otitis media, simple means non-complicated chronic otitis media that may not produce any pain in the ear. Do you understand this fact? I will talk it slowly. That otitis media, it has two forms. One form is acute otitis media. Another form is chronic otitis media. We see here that acute otitis media produces pain in the middle ear, but we see that in the list of the disease that produces pain in the middle ear, there is no entity. There is the chronic otitis media. This is notable thing. Why it happens, how it happens, that is a matter of explanation. For this time, I want to clarify you that when there is an acute infection, this acute infection of the middle ear, that means acute otitis media, it is acute form. It produces a acute inflammatory change in the middle ear. The five criteria of the inflammation: rubor, calor, pallor, dolor, functio lisa. All these things will remain in the middle ear when there is the acute inflammation. And when there is the chronic inflammation, it is the it is a sign of inflammation, and there is attempt to heal in the middle ear. So where there is the long standing inflammation, the pain sensation is reduces. But if we ask you that is there any chance of pain in the chronic otitis media? If we ask you whether can you mention us a, a single condition where a chronic otitis media has the pain, then you can say it when there is the acute inflammation, when there is the acute on the chronic otitis media, that may cause pain in the chronic otitis media. Am I clear, or am I make it more complex? Okay, I have no way to take feedback from you. I want to ask some questions to you so that you can participate with me, but I'm not sure how can I take your opinion. How can I take your opinion? Do you understand me? Instead of while I'm checking this type of live class for fourth year, they have asked me, they have they have asked me for some advices There is first advice they told me to take the class in Bangla, but I am now I am giving you the lecture in English as because you are an international student. If we talk the thing in Bangla and it is recorded on the YouTube, that may reduce our standard a little bit. For this region, I'm talking you with English. But if you feel any discomfort or if you feel boringness, then response me with comment. I am seeing the comment in my right side. So if you want to reduce the boringness, and I do prefer that to ask you some questions. Here I am describing the local causes that may produce the ear pain and what you have understood and what you could retain about the knowledge. I want to uh, make some tests, but in this online class I cannot take this. Okay, leave it. So the symptoms are pain in the ear. The local causes of the pain are the some causes in the external canal, external ear, and some causes remain in the middle ear. Now we want to see the second cause, that is the referred causes. Referred causes. First of all, you see the referred causes here. The referred causes here. You can see the referred causes of Autalgia. Mm, I'm pointing over the picture. Can you see my pointer on the picture? Here I am moving the pointer on the dental causes. Can you see it? My cursor. Can you see my cursor? You are not seeing my cursor. Now I am moving my cursor. Can you see this cursor over the left side of the slide? Can you see this cursor? Okay. In this part, you can see. Here we can see the causes of referred autalgia. Here is the some causes. Before going to this complex, this busy picture, we want to clarify how ear is innervated with the nerves. Uh, you see here the nerve supply of the ear. The ear is supplied with different nerves. You can see the V3, that is the mandibular division of the trigeminal nerve. It is known as the V3. This is the mandibular division. And here is the facial nerve, here is the glossopharyngeal nerve, and here is the vagus nerve. So, how many cranial nerves supply the ear? If I ask you how many cranial nerves, number one, mandibular division, number two, facial, number three, glossopharyngeal, number four, vagus. That means four cranial nerves supply the ear, and another two nerves from the cervical nerve, upper cervical nerve, C2 and C3. This forms two nerves that supply the ear. This supply is the sensory supply of the ear. Sensory supply of the ear. You have seen this picture many times before. The external part of the ear is supplied with the nerves. How many nerves? This is the auriculotemporal nerve. It supplies the pinna in the outer side, and the greater auricular nerve, it supplies the ear lobule. This is the in front of the ear. In the back side, we can see the laser occipital nerve. It supplies the upper outer side, and the greater auricular nerve. It supplies the lower part of the posterior part of the pinna. Now these are the nerves. Now we want to classify these nerves. First thing, the auriculotemporal nerve. It is the branch of the mandibular division of the trigeminal nerve. Second thing, the auricular branch of the vagus. It is the vagus nerve. It is the this concha is supplied with the vagus nerve, and the lower part of the pinna, that is lobule, in the front side, is supplied with the greater auricular nerve. This greater auricular nerve supplies this lower part of both anteriorly and the posteriorly. This is the greater auricular nerve. This greater auricular nerve is the branch of the cervical nerve. Is the C2 and C3. C2 and C3. From this C2 and C3, the greater auricular nerve is arising, and the lesser occipital also comes from the cervical nerves. So these are the nerve supply of the external canal. So we can now we can accommodate here that upper cervical nerves that supplies the skin of the in front and behind of the auricle and lobule. This is the two cranial nerves, and two spinal nerves, and four cranial nerves that are the mandibular division of the the trigeminal nerve. It supplies the tragus, helix, anterior aspect, external canal. Here we can see that this is one thing. This is auriculotemporal nerve. This is the helix. This is the helix. This tragus and other part of the ear is supplied with this trigeminal nerve. Facial nerve. Now we can see the trigeminal nerve. Here is one division of the trigeminal nerve. This is the mandibular division of the trigeminal nerve. This mandibular division has the auriculotemporal. Here we can see the middle meningeal artery. I want to zoom it. How can we do this? Zoom it here. Here is the zoom. Okay, fine. Okay, fine. Here is the more and more zoom. Here we can see that this is the foramen oval, from where the mandibular nerve come from a rotundum. I think from a rotundum, from an oval, the mandibular maxillary nerve. From this foramen, the mandibular nerve descend down, and here it gives a posterior branch that encircle the middle meningeal artery. This is the this is nothing but the this is nothing but the auriculotemporal nerve. This is the auriculotemporal nerve. That means it supplies the auricle as well as the temporal region of the face. So this is the auriculotemporal nerve. This nerve supplies the ear. This is one cranial nerve that supplies the ear. Another cranial nerve supplies the ear is the facial nerve. Other two is glossopharyngeal and the vagus nerve. Here we can see that there is the mastoid process. Can you see? This is the mastoid process. In the mastoid process, there is a process. There is a styloid process. So in between this, there is a foramen, there is a stylomastoid foramen, from where the facial nerve comes out. Where this facial nerve comes out from the cranial cavity, this forms a branch that is known as the posterior auricular branch. It supplies the posterior part of the ear, the external canal, tympanic membrane, and the external canal. This is supplied with the posterior auricular branch of the facial nerve. Other branches of the other branches are the glossopharyngeal nerve and the vagus nerve. Here we can see that there is a plexus that forms over the tympanic membrane, that is the tympanic plexus. This tympanic plexus is formed the tympanic branch of the glossopharyngeal nerve, that is known as the Jacobson nerve, and some branches from the vagus that is known as the Arnold nerve. These two nerves, glossopharyngeal nerve and the vagus nerve, forms the tympanic plexus. So these are the innervation of the ear. So now we can see that what is referred otolgia. It is a short question for you. In the written exam, you may ask to write a short note on the referred autalgia. So what we have learned till now, that the auriculotemporal branch uh, of the fifth cranial nerve, that is mandibular nerve. We have learned the vagus nerve. We have learned the glossopharyngeal nerve, and we have learned the cervical nerves. So how the sensation from the air is transmitted to our body, it is a very complex job. It is a very complex job. The air is now, this is the now here is the full screen so that we can see this thing. We can see this thing. Now all the things can you see all the nerves? Referred autalgia is very much interesting thing. Interesting thing is because you have learned it, the pain that originate in the gallbladder, left side of the abdomen, and that is filled in the shoulder tip. How it is happened? How it is happened? You have some explanation, but it is not my matter. I'm explaining you how pain in the other part of the body can transmit to the air. First of all, we have very common experience that some may have the right now. This is the hot environment, and more and more patients come to us with tonsils. You may have some throat pains. That's because you are checking the cold water. You should not take the cold water, uh, as because cold water may cause the injury to the mucosa of the pharynx, that may produce the pharyngitis. When there is a pain in the pharynx, you may have experienced such type of pain in the pharynx. You are feeling pain during checking the meal, during speaking, or even during swallowing of saliva. You may feel this pain, but some of you may have such type of experience that you may feeling pain in the ear as well as the throat. How can you explain this? You have a throat pain, but during this throat pain you have a experience of pain in the ear. So how can we explain this thing with anatomical knowledge? With the anatomical knowledge, we can explain that. Here, look at the picture here. Here, here is the glossopharyngeal nerve and the vagus nerve. Glossopharyngeal nerve and vagus nerve. Here is the diagram where you can see that the glossopharyngeal are checking the sensation from the tonsil, from the posterior part of the tongue, and from the nasopharynx. This is the sensory innervation that transmitted through the glossopharyngeal nerve. And here is the vagus nerve that carries the sensation from the pharynx and the larynx. Vagus nerve transmit this thing. So here we can see that the vagus nerve are carrying glossopharyngeal. We are talking two things. We have no picture in right now. I have no picture where we can see that the vagus and glossopharyngeal are how they are working together. Okay, okay. I have a diagram. We'll go there. So how the vagus? Okay, fine. We can see this diagram. The diagram explains you a little better. Here is the here is the here is the diagram where we can see that the vagus nerve. Here is the vagus nerve. 10th cranial vagus nerve. This vagus nerve is carrying the sensation from the supraglottic larynx, and the lower part of the pharynx. So, where you are checking the cold water and you are experiencing a pain in the All are the vagus nerve. Experiencing you are experiencing a pain in the throat. In the throat where? Lower pharynx. For example, in the lower pharynx, you are feeling a pain in the lower pharynx. This lower pharynx, here we can see the lower pharynx, this part. You are experiencing a pain in this part of the body. And sensation from this part is carried through the internal laryngeal branch, superior laryngeal branch, and the pharyngeal branch of the vagus nerve. From here, this pain sensation is carried to the central nervous system, through the central nervous system, through this vagus nerve. When this pain comes to the cerebral cortex, it cannot precisely locate from where it comes. The cerebral part of the cerebral cortex that is stimulated with the sensory stimuli from the larynx and pharynx, the part of the cortex may suspect that it is coming from these tympanic nerve and tympanic plexus from the ear. So, would you understand me? What I am trying to tell you? I'm trying to tell you that there is a pain in the pharynx that is transmitted through the vagus nerve and reaches to the cortex of the brain, but locate brain cannot locate it precisely from where it comes. Then brain has a signal, brain can suspect, brain can imagine, brain can produce that this pain is coming from the ear. We can see no pathology in the ear, but patient may feel pain in the ear. So, for example, another thing of how the pain is carried, you will be clear with this through the mandibular nerve. Through the mandibular nerve, it is very easy. We have a picture with here. Here we can see that mandibular division. Here is the mandibular division of the trigeminal nerve. It is supplying this part, this part, this part. Theoretically, different, many parts. It is supplying. When pain in the dental root, when pain in the salivary gland, when pain in this part of the tongue, when pain in here and there, they will transmit it through this nerve, and the nucleus of this nerve have have an experience that there is a pain. There is a pain. So when it feels the pain, it feels the pain in the tooth. Sometimes the pain is felt the nerve, auriculotemporal nerve, in this part. So pain is transmitted from this part and pain is felt in this part. So we can call it, this is a sensory error. This is the sensory error. How this sensory error is produced? I have explained that sensory error is produced by the body for the lower precision of its uh, localization of the sensory stimulus. So I am explaining you the referred autolgia. Do you have any question about the referred autolgia up to this? Do you have any question? This figure is explaining the referred autolgia better, that this part, pain in this part, pathology in this part is carried through this nerve, but pain is feeling in this part. That is a sensory error. Do you have any question? Are you present here? I am seeing that 25 people are with me. Are you there? Can I make any poll here? Are you there? Are you? Where you are present or not, I am not sure how many. You may open the sometimes we have experienced that you are opening this thing and you are going to check the mail, you are going to Even some of them go to the checking a shower. There are different experiences we have. Yes, yes, some are responding. Yes, Aisha, Tasmiya, Hafsa, Nadila, Noushin, Mahfuja, Fariha, Nabila Siddiqa, Anika, Purna Orunima, Purna Onurima, Fatimatu Johra, all are female ladies. Shojib Mandal, yes, thank you. Tasnima Haq, Jannatul Firdaus, Rabiul, two guys here, Tasnim Ansari, Esha Haq. Two are male students, rest of all are female. Oh, Aisha Haq, Faria, Rupa, Ifadul, is Ifadul present here? Roommate of Ifadul? Or Ifadul, yesterday I have Muhaiminul present. Sajin, where is the Ifadul? Bring him in this lecture. And yesterday I have give you, I have forget to whom I have asked to make sure the presence of Ifadul. I have forgot the name of this student. Faisal Hussein, Muhaiminul Islam, Priyanka Sharkar, Saznen, Juaid Hussain, Umme Mahfuza, A, B, C, D, E, F, G. Why you are disguising you? Why you are disguising from us? Alamin, Alamin Alif, Alamin Alif. Sharif. Is Sharif present here? Sharif is present here. Both of you are absent here, Sharif and Ifadul. Bishti Shurovi, Moshiur Rahman, Jamaluddin Chowdhury. Okay, so we have taken about 40 minute class. It is noon, a little bit afternoon. It is a time to take the rest and take your meal. I will not I will not lengthen my class anymore. If you have any question, you can ask me here, or you can ask me in WhatsApp. New joined with us Brishti Shuravi, Fahad Hussain, Sabiha Rahman Shobha, and Shanjida Anjum. Okay. Rest of where rest of the students are right now. Faiza Rumin. So late. You were so late. Now is the what environment remaining around us. So we are making we are trying to make more comfort for you for this region. I'm taking this class so that you may take rest in your room and you can participate this thing. This is not to escape the uh, knowledge or reading. You have to read it, you have to memorize it. Hassan Ali, Sumaya, Mariam, you have to take Shamima Akhtar, Shimla present. Oh, present, but why not with her device? Why with you individually you can participate with us. So, if you have no question, then I want to give a big thank for this 33 now 33 present to you. Okay, thank you. We will see you next class in the scheduled time. Thank you all. Thank you.